for joining us today. We really appreciate your time. I just wanted to start this off by prefacing that this whole thing is voluntary. It's totally up to you guys if you want to participate. Obviously, it is encouraged, but it is voluntary. And this program is going to be a first come, first serve. So we're going to offer it free for all of our employees covered under our insurance first. We're going to give you guys 4 weeks to sign up, and then it will go out to your spouses or dependents on our insurance. If you guys are not on our insurance or are interested, it's $200. So just want to start off by saying that. Go ahead.
So for those of you who don't know me, Paul Belletti, I'm the fire marshal here in Madison Heights. But more importantly today, I am the president of the Jeffrey Brozich Healthy Heart Foundation. This foundation happened after a tragedy that occurred to the fire department March of 2021. My friend and Captain Jeff Brozich, while on duty, had a massive heart attack and lost his life. The good that came out of that tragedy was this foundation. It's still hard to talk about, and it's been almost 4 years now. So the way it worked at the fire department, we're 24-hour shifts. We come in at 8 in the morning, get off at 8 the next morning. The captain, he's responsible for all the guys on duty that day. They're his guys, right? That particular morning was a really busy day. They did some physical training in the morning. There was a small fire. They did 12 EMS runs before midnight. Jeff was a very handsome and well-built, like bodybuilder type kind of guy, always in great shape. About midnight that night, he went to the bathroom, and as he was using the urinal, rookie comes in. Hey, Cap, how you doing? It's like, good kid, going to bed. Jeff retires to his room, texts his wife at 12:03. He says, "Night, hon, love you, going to bed." His wife is Lindsay, who was a police officer here in Madison Heights. They've been married 18 months. A couple hours later, at 3:20 in the morning, a 911 call comes in. The tones go off in the building. Everyone runs to the fire trucks except for Jeff. When the rookie didn't find him, he went to his room, knocked on the door, opened up the door, and found Jeff down. Through the medical examiner, it turned out that just after, like minutes after he texted his wife Lindsay, like going to bed, he had a massive heart attack. The goal of this foundation that was founded in Jeff's name, our goal is to get a calcium scoring test or a CAT scan done of the heart. Our goal was to get every firefighter and every police officer in the state of Michigan one of these tests done for free. These tests are the leading indicator to show that there's an impending cardiac event potentially happening. If Jeff would have had this test done with months before or weeks before, he would have known that there's a buildup of calcium in his heart and potentially could have saved his life. The great thing is that Melissa found out about us testing at the fire department and starting the testing at the police department, and came to us and said, "Hey, I want to do this for our employees." It's a simple test. It can give you tons of information. It's not shared with the city, but it's something that the city is now offering to you guys, and I would highly encourage you guys to go through this so that your families, your extended families through work don't have to go through the tragedy that we went through. With that, I'm going to turn it over to Christine.
I'm Christina Donegan. I'm with the foundation, but I actually am that was Jeff's sister-in-law. My sister Lindsay works at the police station over there. And I'm here to kind of share my story as well with Paul. I had the daunting task to having to meet my sister here the night that Jeff passed away. The feelings that I had as a sister and a family member, I hope that none of you here have to ever experience, because it was awful. I'm in the medical field, so for us to kind of experience what we did and kind of knowing on my end, and I do that it could have been prevented, it was pretty scary. And for me, I didn't realize the significance of first responders and how it really affects them, and their rate of having a cardiac event is much higher than someone like myself who just works in the office. with no genetic history. Has anyone here heard of a calcium score? Has anyone here heard of CT scan? Okay. We all have kind of heard of like a cardiac CT, right? Well, Paul goes through and says, hey, listen, he actually had he could have shown the blockage. But what was very upsetting to us is obviously we found out he died of a massive heart attack. The MD tells us that he had scarring on his heart. He had a previous heart attack that he didn't know about. My sister didn't know about. His daughter didn't know about. So other than just taking a bit of a cholesterol pill, because he had a little bit of high cholesterol, the guy was healthy. For us here, I said this earlier at the 9 o'clock, I have to go through a physical every year and I get my blood drawn. And it's required for my insurance and I'm on my husband's insurance. So if I don't get it done, it shouldn't force me to get it done, but my insurance rates go up. But for me, I'm young. I have 2 boys that are young and I have a husband. I want to make sure that I'm going to live a long time. But that's just a basic, right? We just go through our thyroid panel, our cholesterol, we get our normal things that are always required and covered by insurance. This screening, and we preface it screening versus a medical diagnostic. Medical diagnostic is you're getting a script from a physician, and that physician is referring you to an imaging center, a hospital, or other physicians to have these things done. You run through and kind of do your basic cardiac workup, which is like, it could be an ultrasound, it could be a stress test, but those are all done with your primary care physician generally at a certain age point. For us though, is what happened out of this tragic moment is like, how can we make a difference and how can Jeff's legacy live on? And one of the things is, it was a learning process. This isn't something that just was thought of. This is something that's been done with other hospitals. This is something that's been done kind of in our Metro Detroit area. They basically going through and saying, yes, you can go through and get a screening done. And that's kind of it. But for us, it was learning the process. I didn't have that kind of knowledge that this affected them so greatly. And then you go through the questions of, well, why does it affect them so greatly? Because it could be how many wake-ups they had on the job, how many fires that they fought, how many hours in training. I don't know that Jeff went on runs that day, but he had 4 hours of training that evening. Then he went and had a meal. And the only thing that we knew about is he was complaining of heartburn. And that heartburn led into his final heart attack that took his life. So it's not a scare tactic to get everybody involved and try to get this done. It really is this is a tool to kind of go on a corrective plan if you score high or there's something wrong with your heart. And again, this is a screening purpose. You don't need a doctor's order for it. We have partnered up with a group called Ascent Imaging, which is at 12 and Telegraph. We've also have a specialized route, what we call with the health department, with Michigan Health and Human Services. Right after Jeff passed, within months afterwards, we were actually able to meet with them and kind of push through the importance of having this done for first responders. And basically for them is this is something that, again, wasn't trying to reinvent the wheel. It was actually, people have tried to get this done for years and years and years because it's not covered by insurance. Not sure why, they've lobbied to have it done, but they just, unless you're gonna do a full cardiac workup, they're not gonna allow you to have this 5-minute test done. And when I say it's 5 minutes, you get there, you check in, you go through this kind of like a screening process with the CT tech, then you get changed into a gown. The exam is 5 minutes, non-invasive, you don't have to ice or anything put through your body. You get dressed and you leave. Where our work comes in with the foundation is that we have partnered up with a unicorn, which is a cardiac thoracic radiologist. Yes, radiologists actually read these scans on a day in and day out, and they kind of do a general radiologist with kind of a rotation in cardiology. Dr. Morales and his group were actually thorough with the cardiac thoracic side of it, as well as being a radiologist. So it's like double boarded. So for us, we wanted something that it wasn't just going to be left. And again, it's no dodge towards the hospitals, but what we found is that there was no follow through. You can kind of go through, we've all heard of my chart, right, through Beaumont, you can kind of get your results. But that was it. If you go through and you have these screenings done, I can check in my chart, but a lot of us don't understand what the medical jargon is. Could you honestly say and give us a rate 0 through 400, which is what we rate through the calcium scores, where an average would be? What we found though is that again, through genetics and what you do for a living, your rate could be probably is 90 or 92. You think, well, that's high, it's not zero, right? Then you talk to the physician, it's like, well, we're just gonna have a little bit of a corrective plan. 400 is never gonna change for someone. If you have 400, it's obviously high. We wanna make sure that you see a cardiologist. But for us in the end game is just to have this baseline for a screening method, preventative side of it, and have this done for people like us, as I say, it's, we're not police and fire, it's done probably once every 5 years. For our first responders, it's done every 18 months because again, we set that baseline for them and we just want to see what they go through, put their body through for those 18 months. With this city and what we talked to Melissa about and she's approached me and Paul, it was something that has opened up, I don't want to say the floodgates, but having a city back up their employees because of what happened, and I'll introduce you to Nate in just a second, it just sets the tone. It means that, obviously they care about their employees, but for us, it's coming through here and they've offered to pay for this through the foundation. It's opening up that access for you to get this screening done. Again, it's not required. None of the information is going to be sent to the city. And I do want to state that fact over and over is the only information that they're going to get is that you have the scan completed. Because then they're going to obviously pay the foundation through that. But that's it. The report's going to be sent between you, and then we do request that you put like a primary care physician or a cardiologist if you already have one. And then that report gets sent again to you and to the next physician upon the request. There will be a callback if you have some sort of number that is an issue to you. And you will talk to either Dr. Chris Morales or anybody in his group. And then after that, we kind of deem through the foundation if there's a required follow-up. And our required follow-up is just, how can we connect you with somebody? Do you need a cardiologist? Do you need a primary care physician? We are not affiliated with any hospital network, nor will we be. We're not affiliated with any cardiologist group or primary care group. Our job is just kind of to be that liaison to make sure that you do have that follow-up care if need be. And then if you score low, that's fantastic. You've got that baseline for yourselves, and maybe in another 5 years you can have them done. But the reason why we've had it done is just because we are true to this foundation is going to save lives. And introducing Nate, for those of you who don't know or didn't know, is that Nate took the captain's position after Jeff had passed. So Nate has worked with Jeff. He was a friend, and when Nate went and had his scan done, there was an issue with it. He can go into details, but our whole purpose was this, is that for some reason, I want to say it's ironic, but maybe it's not. But the reason being is that we were able to save somebody here, and that person gets to tell his story on our behalf because of what we do and what we're going to continue to do.
Thank you. My name is Nate Figueroa. I'm a captain here in the fire department. First and foremost, I want to thank the foundation for forming and allowing me to have this knowledge to take the steps that I need to take to better my health moving forward. More importantly, Melissa, I want to thank you for acknowledging that this is a simple test. You certainly have no obligation to offer this to the city employees, but out of the generosity and kindness of your heart, you see the vision and the value of it, so thank you. So my story, as you guys all heard about Jeff, Jeff was my boss when I started here, and he was a friend of mine. We were both fathers and husbands, and we shared a lot of likeness in that. Obviously, when Jeff passed away, it was just a huge shock to the department. One part that Paul left out of his story was we had to take down all the mirrors in the firehouse because Jeff was so handsome that he wouldn't ever make it to the truck in time. So every mirror he walked by, he startled himself with how pretty he looked.
But actually, it just goes to the point.
He was fit. He worked out all the time. Yeah. He was one of those guys who was in the gym every single day, despite calls. A lot of times, myself included, prior to some of the knowledge I have now, I'm sure some of you guys can attest to this. It's easy to make excuses as to why you're not gonna, go to the gym or eat the salad or whatever it might be. So yeah, when Jeff passed away, it was just a huge loss and a huge tragedy. And then this foundation formed, and again, having to take a promotional exam because one of your coworkers passed away is an odd enough, position to begin with. And then to be honored to be selected for that position. And, like Christina said, that really the irony is then this foundation forms, and I'm really the first person to get some negative results in this testing and screening process. A little background about me is, I'm a father of 5, and a husband and a brother, and a friend and a coworker, and I want to, be here for everybody in my life. So, I have some pretty significant cardiac history in my family. So I had already, what I thought, taken the right steps is to make sure that I was doing the right things. I was getting my blood work. I had some elevated cholesterol. I was taking my cholesterol medicine, albeit admittedly not with 100% compliance. Prior to, having the knowledge that I have now, and miss a night or two or run out and not get it filled, and, but I stayed fit. Every year here in the city, we get a stress test for the fire department. Get on the treadmill. I mean, all of the preventative stuff that the insurance offers, I was doing. And I really thought I was on the right path. So I went and took the CT scan, and it is the easiest medical procedure you'll ever have done. You walk in, and there's a small check-in process where they'll take your vital signs. They take you back there. They get you in a gown just because they got to do an EKG on you. You lay on a table. It slides you in, and it spins around your head for five, maybe not even 5 minutes. I mean, you're in and out of there in 20 minutes. And then about 2 hours later, I got a phone call from Dr. Morales. Oh, wow, this is great customer service. He's tell me everything's excellent right away. So I answered the phone call, and he let me know that I was in the 99th percentile for calcium score, but not in a good way, in a bad way. And that I needed some follow-up testing. So then I kind of called Christina in a panic, not knowing what the heck was going on and what I needed to do. And I think there was, I think we were sharing that a little bit. I don't think either one of us anticipated the first batch of scans to be the one that found something significant, especially with me taking Jeff's position. It was just really, really odd. So I consider Jeff really to be my guardian angel, and he's given me a second chance at making some right, health decisions moving forward. Like all of us, the knowledge is power, and having that knowledge and to really truly make the right choices. We all know what we need to do, right? But for whatever reason, there's something in our human nature until that flames up under your butt a little bit to get up off the hot seat, and then all of a sudden we do it. So, long story short, that just led into me getting some more tests that kind of confirmed, the next test that I had to get done was one where they inject some dye in, the same procedure, but they inject some dye. That was showing essentially 100% blockage. I took it to my cardiologist, which the foundation's physician helped with that, because here I am now calling a cardiologist that I really don't have any rapport with. All my healthcare has previously been through my primary care physician, going, hey, I need in right now. I need to go to a cath lab. And they're like, who are you? You're not even a patient here. So there was some help certainly with the foundation in connecting those dots and the seriousness of that. And I got in to my cardiologist, and they were able to look at all of the imaging and the test scores from the foundation. And he said, hey, we got to get you to the cath lab. How's Wednesday? Ironically enough, it was the day that I had the promotional exam for the fire marshal's test. So I told him it wasn't a good day. And he said, man, you got to get in. Like, well, you can't push this back. And I'll just push it back 2 days. Friday works good. So I went in on Friday. The cath lab is where they will go in either like through your groin, or they go into your arteries, up into your heart, and they inject some dye, contrast dye, and they can see the blood flow through the circulation of the arteries on the heart. The intent when I went in for that, what the cardiologist had told me was that they were planning on doing a bypass surgery or a stent if what they saw in the CT scan matched kind of what they found when they got in there. And it was worse when they got in there. What they found was 100% occlusion, zero blood flow at all through my right coronary artery. Thankfully, the heart has the ability, and some people more than others, to build its own collateral circulation of blood flow. And I knew this a lot because my dad had experienced a very similar thing at a very similar age as me. So I knew about this collateral blood flow. I didn't know until talking to my cardiologist that not everybody has it, and not everybody has it in a capacity that is adequate. So, here I was knowing that I'm, facing a blockage that kills some people, so I'm already just really thankful that, that I'm still here. And most importantly, all of this information gave me that, that power to make a plan and to look in the mirror and to sit down with my wife and, and really myself and do a little bit of soul searching as to what my health is going to look like moving forward. So, I'm here today just to encourage you guys all that even if you maybe you think you're doing the right steps and you're getting your annual physicals and your blood work and maybe you're taking the pills for your cholesterol and your blood pressure, that there, is another very important thing that you can do that can just give you information that no other test can do. So, again, that's my story with it. I hope that you can, draw something from that and some inspiration to at least get out, get the scan done. And again, Melissa, I can't thank you enough for bringing it. When Chief brought it to me and said that I said, man, this is, it truly puts the stamp of City of Progress, because I don't think there's anybody else out there doing this. So it's really outstanding that you made a decision to do this. So I would encourage you guys all to do it. If you have any more questions at all, you can certainly reach out to me, via email or give me a call. I'm at the fire station 24 hours at a time, 10 days a month. Until I take over for Paul. I will be the next fire marshal come April.
He's going to be so much better than I am.
I'm looking forward to learning that role. And I'm sure that's going to broaden some of my relationships with you guys over here because I'll be in the building a lot more. So, but that's it. I'm thankful. I'm thankful to be here today. I'm thankful to share my story with you. This is the first time I've ever really shared my story in front of any platform. So, but I look forward to to tweaking it and mastering it and sharing it as far and wide as I can, because I knew from the very beginning I was 100% behind everything that this foundation stood for, and I knew that it was going to save lives. Never in a million years that I think mine would be the first, but here I am, and I'm grateful for it. So.
Now he's set up with that corrective plan. So it's, kind of look at it as yes, it was a medical diagnostic event, we call it, but it was a screening that started this whole process. And allowing ourselves to have those kind of tools, especially when your city employer pays for that. Again, sometimes people look at it as kind of a scary situation that they don't want to go through, and out of sight, out of mind. They don't.
It is.
It really is, honestly. It's kind of no different than going through like a brain scanner. Which there's screenings for that as well. But people just don't want to find out. It's nervous, and rightfully so. But it's 2025, and for us, we do have our basic tools that we are allowing ourselves to do every year. Is our physicals, our stress tests, our ultrasounds. Why not give a little bit of extra, and especially when your employer is covering it for you? It's nothing scary. I can promise you that. And just as Nate is standing here, I'm hoping that all of your scores, if you guys decide to do it, are zero. But if it happens to be a number where you have to do a follow-up, that's something that is accessible to you, and there is follow-up, and you're going to be here, and you're going to have that type of corrective plan. It's not going to be necessarily what Nate is, but it just sets you on a different path. And then it allows you to go back to your family or just give that little present to yourself. Like, hey, I want to be here. I want to be able to do this for my kids and my family and my friends. And really, this foundation, that's what our core values are here, is that we can save one life. Again, never thought it was going to be Nate, but man, I wish Jeff was here this day. I really do. But again, he's not here. And for some reason, Jeff was able to save Nate's life. And it gets me choked up thinking about it all the time. I really feel and truly believe that we are here to make a difference. And it starts off with just not only our first responders, but also our municipalities getting behind this as well, because this is the work that we want to do, and I really encourage you guys all to look into that. So if you ever have any questions about it, we'll give you the information, the email, the foundation. Even questions on the tests, on the clinical side of it. Again, it's very non-invasive. It's very, very, very short, about 5 to 7 minutes, pictures of your heart. But really, it's going to be between you and that follow through with one of the physicians, with Dr. Morales' group. And I can't stress this enough. Caitlin, Melissa, none of them will get your reports. It doesn't get back to them at all. So we do encourage you to get it done, but understand that maybe you've had it done or you don't want to have it done, but just ask the questions.
Just for what it's worth, I guess it's worth sharing that, my corrective plan was not drastic. It wasn't life altering per se. It was, just be more diligent about the things that we all know, are healthy for us. But like I said, for me, it was just that catalyst to really, really allow me to now, with all of the knowledge, make the right choices. So, it was a little bit of tweaking in medicine, a little bit more frequent follow-ups at the physician, and then, dietary changes and exercise. So, like I said, it's not something that we all, and exercise, this was the greatest thing. The doctor's like, hey, walking counts. We always think exercise, you gotta go out there and sweat and, it's all grueling. No, like at your lunch break when you're done eating, go for a 15-minute walk, right? I got one of these little ring trackers now. This thing's yelling at me all the time if I don't get my steps in every day. But it's simple, right? So you can take simple steps, that really make a big difference over the long term. And that's what this is about, is having that knowledge so that if you need to take those steps, that you can start doing it now so that you can be here.
Any questions or anything from anyone? So I will send out a link to a Google Docs. You can go ahead to sign up, put your phone number and then your name, and then there'll be contact if you want to schedule an appointment. Also link to the website of the foundation if you're interested in learning more about it.
So Ascend Imaging will be contacting you to schedule if you put your name and number on there. We'll go through a list of questions and then we'll schedule it with you. They're not set on a certain day, so it's basically whenever your schedule is available. They're open Monday through Friday. They're at 12 and Telegraph. Again, they're not connected to any hospital network, so they are private. Pretty easy, pretty accessible. So once, I believe Angelina is going to be the one calling you to schedule, but once you get that scheduled information, once it's completed, the only reason that the city will know is that you have the completion done, and then that's when they will cover the cost for it. And that's it. So again, I encourage you guys to do it, and encourage the questions too, because the more knowledge you have about it, the better. And again, it might not even be something that you have to have some sort of effective plan, but at least you have a baseline for yourselves.
Now, if you don't have insurance with the city and you pay for it on your own, and they find that you're in a dangerous percentile, would future checkups be covered by likely be covered by insurance?
So how we're operating is basically, because we're able to do this because we call it a screening. Once that initial screening process goes through, and if you do score something that needs a follow-up, then that becomes a medical diagnostic consideration, is what we call it. So that way you'll get that report, and that report will be given to you. But our job, kind of our bridge, is if you don't have a primary care or a cardiologist, we want to make sure that you have one. We are not partnered with anybody, but we have numbers private practices. We also have physicians' numbers that are through Beaumont, Ascension, a couple of different hospitals. But with that being said, if you have that, then it becomes a medical consideration. And then that way, if any further tests, kind of like how Nate went through. Nate was a little different because for us with the foundation is if they do score, our job as well as actually is to provide those CCTAs, which is the coronary CT that he went through. That was the injection, not the cath lab. So basically he just went and had the same procedure done, but we went through and kind of checked out all the valves and the arteries just to see how much of a blockage that Nate had. He has the true widowmaker. But for yourselves, that would be considered with the physician, and you do a follow-up from that end. So then it becomes a written order from your doctor, and then you'll go through the process of getting it through. The reason why we kind of encourage it through the foundation is that there's that follow-up that we have with Dr. Morales' group. He doesn't work for us. We just specifically are partners in this. So for him on his side with his practice is that he actually looks outside the box. It's not very cut and clear, like this is the way you should be. He treats every individual as an individual. So what I have going on with my health is obviously different from the next person, right? But even if, per se, I did have a blockage with me, my corrective plan is going to be different from him. So I think for the most important part of it is just making sure that you have that initial setup and that you're not having to worry about kind of climbing through your mind chart to kind of figure out what exactly this report means. You're getting a call back from a physician through the group if you score high. But even if you don't score high and you are a 0, there is going to be a very baseline of instructions like, hey, this is great, your number is good. We'll see you in 5 years if you decided to go through it. Does that answer my question?
Thank you.
Well, if there's no more questions, thank you all so much for coming. We really appreciate it. Taking the time out of your day to listen to us, it means a lot. So thank you.